Robert, let's start with you, because I know that you have spent many, many years working with people whose health has probably been damaged by smoking. As a professor, why are you throwing your weight behind e-cigarettes?
Well, e-cigarettes are just one option for smokers to get off this dreadful treadmill. And I think that...
Why do you like them so much, if that's the right way
I don't see it like that. I see that my job is, as a researcher, is to find ways of helping people off this treadmill, and e-cigarettes seem to be, as far as the evidence is today, one way of doing it. There are other ways. We have fantastic NHS stop smoking services, but there are a lot of people who have used them and didn't find them helpful, or who don't want to do it that way. So e-cigarettes are an option for them.
Deborah, this is a man with many, many years of medical experience. I mean, it sounds very sensible, doesn't it?
Yes, and we don't disagree on that. I think where there's some disagreement, not necessarily between Robert and me, is about the level of regulation that's needed. ASH supports the use of electronic cigarettes. We did the research that shows how many people are using them, and a third of those people have quit smoking altogether. That's a good thing.
So what do you disagree on? What is it that you have a problem with?
There are concerns both about the product's quality and safety, so we want to make sure they're as safe as possible, because although it's a lot safer than smoking using electronic cigarettes, still some of the products have some things that cause cancer in them, and we want to make sure they're so safer than they are at the moment.
So you want tough regulation.
The other issue is about use amongst young people.
Right, OK. Let's tackle regulation first. So, Deborah, you want tougher regulation, and Robert, I'm sure you're concerned that if it's too tight a regulation, then people who want to give up smoking will just not bother trying them. Is that what you're worried about?
It's getting it right, and we have a very progressive regulatory system in this country at the moment. If we go down the medicines regulation route, which is, I think, what Deborah's probably keener on, the problem there is it's very expensive and it takes an awful long time.
Well, this is from Gary Townsend via Facebook. Says, I won't touch chemical inhalers. We don't know what's in them. If you did, you wouldn't use them. We don't yet know very much about e-cigarettes, do we?
We know quite a bit about what's in them. I mean, obviously there's huge variety. There's some nicotine, there's propylene glycol, which is stage smoke.
And being addicted to nicotine, I mean, is that bad for us?
Well, it's not good, but it's not going to kill you. That's the point. Yeah. What we're looking at here is, in this country alone, about 100,000 people a year dying because they smoke. Now, an awful lot of those people, the vast majority, would rather not. And some of those don't mind using nicotine, and if they can do it safely, jolly good.
Deborah, can I read this one for you? Alison Wilkerson, again via Facebook, says, what annoys me is they're being advertised on television, and where they're, in my view, dangerous as cigarettes. And you talked about children as well, and so your concern is that young people are starting to smoke these.
Yeah, I mean, she's wrong. They're not as dangerous as cigarettes. They're much more like
advertised on television, are you comfortable with that?
I think the thing about advertising is we don't want them to be promoted to people who've never smoked, and in particular to children and young people.
But that's what's happening. You can get chocolate-flavoured ones.
But the advertising is being revised at the moment, and the advertising will be changed to prevent it being so difficult, so easy to promote them to children. I think that's really important. And the flavours as well. The regulation will come in, so you can't just have, I don't know, ice cream flavour or chocolate flavour.
Before we go, let's get your opinion on that, Robert. Are you comfortable with children smoking?
No, obviously not. What we need is marketing to smokers, as a way of showing them that this is a way out of smoking. We want a ban, which we will get, on sale to people under the age of 18. And we want at least some kind of product regulation to ensure a certain level of quality. And this means bespoke regulation, and it can be done. You don't have to use medicine regulation necessarily to do it.
OK, thank you.